101.1 FM. Dr. Andrew Billon is with us this morning, and we'll get you on a little bit early today, but that's okay. Probably got some sort of medical procedure you've got to be somewhere doing at some point today. Good morning.
Well, good morning, Todd. Thank you again for having me today. I was here, roughly just over a year ago to talk about robotic surgery here at Indiana Regional. Mm-hmm. So in follow-up to that, I'm proud to report on the profound success that our program and how it relates to patients with colorectal cancer. So thanks largely to our Indiana Regional Medical Center Foundation, we have the latest and best technology that Da Vinci Robotics has to offer. This, coupled with our new ambulatory care facility, new operating rooms, new recovery area, and state-of-the-art intensive care unit, we're able to recruit excellent physicians and surgeons. Most recently, in June of 2018, Dr. Dan Clark, I think you met him a few weeks ago here on the radio. He's a national instructor and proctor in robotic surgery. He joined our staff. Dr. Clark brings over 9 years of Da Vinci robotic experience, and he is our new director of minimally invasive and robotic surgery.
He's been on here quite often, and boy, the advances are just amazing, and IRMC has it. It's just amazing to me how quickly IRMC sort of stepped up.
It's really true, and it's very apparent to a guy who was trained classically. I finished training in general surgery in 1989, where all surgery was open. Mm-hmm. So I came in 1989, and the early 1990s, we embraced laparoscopic surgery, and that was wonderful for our patients. And now just within the last 2 or 3 years, robotic surgery has come to Indiana Regional, and it's an entirely new platform and very exciting to be able to offer that to our patients. So,
if you were talking to 1989 Andy Billon and saying, hey, this is what we're doing now, what would he have said?
I would never have believed it. And I've been, again, part of the old guard. Some people might call me a dinosaur. But so I'm a firm believer in what I've been trained to do. And so I'm a relative skeptic to new technologies. Mm-hmm. But really, I think that as a clinician, as a surgical clinician, if you don't embrace robotics, you'll really be behind the times, and
you're gonna miss the boat.
Yeah, I honestly I believe that. I think I'm the embodiment of that. So together, Dan and I, our experience over the last year and a half mirrors the published data. So what does that mean for our patients? Well, patients who undergo robotic surgery are able to leave the hospital faster than open or laparoscopic surgery patients. These patients experience less blood loss, less pain, and have smaller incisions. They have fewer complications. They experience faster gastrointestinal recovery after surgery. Patients are less likely to be converted to an open procedure than even the laparoscopic surgical option. And this attests to the precision and the unique benefits of robotic surgery. So we, as robotic surgeons, why is that? Patients will immediately wonder, what's happening different? Mm-hmm. And in contradistinction to laparoscopic surgery, where we see a two-dimensional screen, granted it's 1080p, the visualization is phenomenal, but now we, as robotic surgeons, have three-dimensional viewing in our work console. We can magnify the field of view tenfold without any discrepancy in the visual quality. Our instruments, instead of being straight kind of instruments, they're now fully articulated and wristed, and that allows for very precise motion. Mm-hmm. And we'll get into why that's important. We also have a relatively new technology. It's called Firefly technology, and it allows us operatively as surgeons to define anatomy, to define blood flow characteristics that can help us in operative decision making. All of this results in dramatically improved precision, which frankly, that's the point. And that's how patients benefit from technology.
Now you mentioned about the wristed technology and the articulation of the instruments around in a body. You literally get to crawl inside that body not literal, but in a figurative sense. You get to actually get inside that body and maneuver around in a way that you never were able to before.
That is really the difference. As a 60-year-old physician, I wanted to learn a new platform and a new technology. Like, frankly, I need a new hole in my head. But it's something that is really it's impossible to argue that the technology at our disposal and how patients benefit makes it a worthwhile endeavor.
Now, this being Colorectal Cancer Awareness Month, and our real focus this month is on colorectal cancer, what is the difference now in what you're able to do in treating this particular disease with robotic surgery as opposed to the past?
That's a really good question. A lot of it is technical, but we can now, for instance, when someone has a colon malignancy, robotically, we make smaller incisions. We can do the entire resection in a three-dimensional view. But one really important aspect is that with Firefly technology, when we remove a segment of cancerous colon and reconnect that segment, how that segment heals is contingent on its blood supply.
Okay.
With Firefly technology, we can flip a switch and it illuminates the colon, the area before the connection and the area after the connection and the area of the connection. Tells us very precisely if the blood flow is adequate or not. The implication of that is if you don't have blood flow, day 3, 4, 5, you're going to have a leak.
Yeah.
And you're going to have problems that may result in your having to go back to surgery, maybe have a colostomy, where now with this technology, it makes that much less likely.
Yeah.
So that's just one element. The articulated instruments allow us to reach portions of the gastrointestinal tract that otherwise would be very difficult to do laparoscopically. We can do connections now in the colon very low down. I did a resection a few weeks ago that a woman had a very low-lying rectal malignancy. And we were able to remove that to negative margins and give her a connection very low down in the rectum, where in the past, technically, that would have been either impossible or profoundly more difficult.
Dr. Andrew Billon is with us today. We're talking about colorectal cancer and the advances in robotic surgery, which make the treatment of it so much, I don't know if easier is the word, but more successful might be a better way to put it.
It is more successful all the way around. The surgery might take a little bit longer, but what patients see and feel is a more rapid recovery, less pain, fewer complications, less risk of infection. It's hard to argue that. Some might say that it's a bit more costly, and certainly until you're on the learning curve and comfortable in that new medium, that goes away very quickly.
Yeah.
So
we're talking here about the treatment of, the surgery for. Obviously, with colorectal cancer, you want to catch it before that surgery becomes necessary.
Yes.
And Dr. Clark was here emphasizing that point last week. That's the really the key to it all, isn't it?
It certainly is. In 2017, there are an estimated 134,000 new cases of colon cancer. And colon cancer is the second leading cause of death in our country, second and third. There is no question that we as patients and physicians can do better. And I think we are. We're making tremendous strides. As an example, 83% of current colorectal surgeons are being trained on the Da Vinci robotic system. So the trend is clear.
Yeah.
And another example, in the Seattle area, the Swedish hospital system has over 100 Da Vinci robots throughout its system, where colorectal surgeons who had previously been trained classically or laparoscopically now are going back to be trained robotically, not just nationally, but worldwide. So we're very proud of what we have here at Indiana and what we're able to offer our patients.
Just a few minutes left with Dr. Andrew Billon. When you began to train on the robotic surgery,
yes,
how quick of a pickup was that for you?
It was. That's a great question. So it's an extrapolation of laparoscopic surgery. If you can envision going from open surgery where everything is open and you know the anatomy very well and you can manipulate everything, laparoscopically, now you have a closed abdomen and that affords its own benefits. But now robotically, we have all of that and much more. It's sort of laparoscopic surgery on steroids. So it's not a new language. It's a new platform, a new tool. So patients envision a robot as we're in another room having a cup of coffee with our feet up somewhere. But no, it's actually a very high-priced piece of equipment that the surgeon is integral to. And we're in the same room as the patient, and we have complete control over everything, even more than what we had in the past.
That's just an amazing technology, and it's here at IRMC. That's a fascinating thing. Okay, so closing minute with you today.
I'd like to invite all of our listeners to a colorectal cancer event sponsored by Indiana Regional here in Indiana on Monday night, 6 p.m. at Rustic Lodge. That's Monday night, March 18th. We'll have the new Xi Da Vinci robot there. Dr. Clark and I will be there to host questions. So far, our response has been excellent, and you can reserve a seat by calling 724-357-8088 or 888-452-IRMC. So we hope to see you there. It's a very exciting time for our community, and So,
and we got to make the point that when you see the signs and it's time to come to the surgeon, that probably could have been forestalled because by the time you see the signs, you're already advanced.
That's entirely true. There are guidelines that are fairly specific guidelines, but within those guidelines, there's a lot of variability. It's very important now more than ever to see your physicians regularly and adhere to the criteria and standards that have been set.
Yeah, get the screening done. 724-357-8088 is the number to call. Make your reservation. Monday night, Rustic Lodge, 6 o'clock, correct?
Yes, correct.
Thank you so much for coming.
Thank you. Hope to see you there.
We appreciate it. It is the voice of Indiana County, WCCS, AM 1160, 101.1 FM. Chuck Clark with the news next.
Today more than ever, work happens on